right, so it's me again, it's Betsy, and then we have our fabulous director and cameraman, my son, Jonas. Say hi, Jonas. That's Jonas. All right, so this demo is strictly to show you how to use the valve. Excuse my hands, I need a manicure. Okay, so I put it around my hydro flask here. So what you're gonna do is you're going to put the pump, okay, this is the pump, in your dominant hand. Righty, I'm right-handed, so I placed it in my hand, and I want you to place it like this, okay, right in your hand. So then, here's the valve. It's righty-tighty, lefty-loosey, okay, righty-tighty, so I'm turning it right, left, this way counterclockwise is loosey, righty-tighty, lefty-loosey. Now, when I turn it to close it, it stops. Once you feel that stop, leave it, okay? Don't keep turning it, because what happens is you'll break the valve. Also, when you have to release the valve, you do it one-handed, so it's really hard to do one-handed if it's too tight, okay? So as soon as like you loosen it, and then turn it, and as soon as it stops, notice how I just stop, okay? Don't keep going. So when you go to pump, you have to make sure that the valve is closed. If not, won't pump up. Watch, I'll open the valve. See how it's not maintaining pressure? Because the valve is open, you can even hear it hissing. So now I'm gonna close it, okay? So I have it right here. Hold it just like so, okay? And there's a reason for that, because you wanna be able to drive. This is like driving your car. You cannot take a blood pressure and take your fingers off the valve, okay? Because remember, this acts as a tourniquet around your patient's arm. So if you let go, it's like letting go on a tourniquet, and that really hurts your patient. So we're gonna close, and I'm gonna pump it up to about 160. So make sure you can see the dial without a glare. Can you see it without the glare? Okay, cool. So I'm gonna pump it up. Pumps up pretty fast. Okay, went over, that's okay. So right now it's closed. See how it's really not moving? Then I'm slowly going to release the valve, and I want nice, steady, okay? So you can read the number where it's gonna stop to read the blood pressure, okay? And once you hear it stop, you're gonna loosen it. You're gonna loosen it up. Because why keep it tight on your patient's arm if you already heard the last number, which is the diastolic? So what we don't want is we don't wanna see this, okay? So like, and then like you stop, and then you go, oh, that's too slow. Oh no, that hurts. Imagine. Or you don't want to do it too fast, like that, because then you can't really read the number. At least when you're first starting, it's really hard. So I'm going to pump it up again, between 160 and 200, okay? It's closed. I'm going to open. I'm barely moving the valve. Slowly, 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 slowly. Oh, that's too fast, Betsy. Okay, slow down. Slowly, 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 slowly. Oh, I heard it. Okay, release. Okay, so practice that. Okay, open and close, open and close. Remember, every valve, every blood pressure cuff is going to feel different. So before you actually do it on your patient, kind of feel the valve so you can kind of feel, you know, what it feels like. Okay, and then when you're going to hold the stethoscope, it's very important that you hold it with your fingers only, like this or like that. Never, ever, ever with your thumb. I know it shows that in like movies, the TV, and even posters, but this is wrong. It's because they're actors. When you do that, you're accidentally going to hear your own pulse because your thumb has a pulse, okay? So never like this, always like this. And when you're putting it on a patient's arm, don't just set it, really gotta push in. Use your fingers to push, to give that pressure so you can really feel that brachial artery and hear it, okay? Because the arteries are deep. So if you just go like that, barely putting it there, you're not gonna hear anything. Push, okay? You're not gonna hurt them, just push. Okay, next video will be on placement on the blood pressure cuff. Okay, thank you, Jonas.